Thank you.
And we have another item, and this is item 27. This is an addendum to CAME. These are health plan rates.
Good evening, Chair Zaragoza, members of the board, Mr. Power. For the record, Kelly Shirk, County Executive Office, Human Resources. Today we are requesting approval of amendments to the Flexible Benefits Program, the health benefits, rates, and contract providers for plan year 2013. Susan DeMaio is our benefits manager, and she's going to walk us through our request today.
Good evening, members of the board. Mr. Powers.
Good evening.
Early this year, we went out for a request for proposal to bid and potentially obtain bids or replacements for our outside vendors' health plans. That includes 2 HMOs and a PPO plan. With the assistance of our broker of record, that's Mr. Brent Crane with Aon Hewitt, we did a comprehensive RFP. We received bids from 7 vendors, which included Aetna, Anthem Blue Cross, Blue Shield, Cigna, HealthNet, Kaiser, and United Healthcare. With those bids, we received 1 complete bid, only 1, and that was from HealthNet. We received 1 partial bid from United Healthcare. They provided a bid that was higher than HealthNet's and did not include our early retirees. So because they didn't meet the minimum requirements of the RFP, we could not give consideration. Every other one of the 5 vendors declined to quote our business. Our broker of record did contact them, and the reason cited was primarily due to declining membership in our HealthNet plans. So we got creative and began negotiating with HealthNet to see if we could get a renewal that included plan modifications, but to see if we could reduce or eliminate the renewal proposed increase. So we got to work, and we've come up with a proposed renewal that we're asking your board to approve with HealthNet on the same existing plan types. So we're recommending offering a PPO plan, which is a high deductible health plan that has a PPO network and is compatible with a health savings account or an HSA. And we're recommending renewal of 1 HMO plan. It'll be an elect open access, which is a special feature that allows members to self-refer to PPO specialists without having to get a primary care referral, and just makes it a little easier. So we're recommending that the changes to the high deductible health plan will increase the deductible from $1,000 to $3,000 per individual. It'll increase the family deductible from $3,000 to $6,000 per family. And then the coinsurance, the plan currently pays 80%, the member pays 20%. The coinsurance under the new high deductible health plan would increase to 30%, so the plan would pay 70, the member would be responsible for 30. There are slight increases under that plan recommended to the prescription co-payments. Now with the HMO product, we currently offer a high and low option. We're basically recommending that you approve continuation of a low option, but we've blended it in some regards so it's a combination of the 2. So with this new low option HMO, we're actually reducing the office visit copayment from 30 to 20 and reducing the urgent care copayment from 50 to 20 because those are popular and necessary services. We're recommending that we increase the outpatient surgery copayment from $250 to $500. We've added some copayments to complex radiology, ambulance, prenatal and postnatal visits, and then we have reduced the copayment for the generic prescription drug only and slightly increased the others to continue to improve the generic use of prescriptions. So with all these modifications, we've come to this new proposal from HealthNet. In addition, we are certainly recommending that we approve continuation of our Ventura County Healthcare Plan HMO for next year. We are recommending absolutely no benefit or co-payment changes. The employees and their dependents still have access to 100% coverage for most of the services under that plan, as long as they're using our hospitals and our clinic networks and providers. With this, we're recommending that your board approve the rates on Exhibit 1 that range from minus 37.26% to a modest increase of 4.14% for our medical plans. Now, we wanted to also look at some benchmarks for you, because I remember that Supervisor Foy asked me last year. So we went out and we checked with Aon Hewitt, our broker of record, on national increases, and the average nationally is 10%. Aon Hewitt has many clients in Southern California, so we asked them to provide data on both their public and private employers in their Southern California office. Their renewal increases ranged from 8% to 46%. And the final benchmark that we've brought to you is CalPERS. CalPERS, as you know, is region-based. They have different rates for Northern Cal and Southern Cal, but their overall rate increase 9.6%. So we're looking really good. Mm-hmm. We're also recommending continuation of our opt-out feature. And the opt-out feature, because it's based in part on our HMO rates, is actually going to decrease this year by 3.09%, and we'll continue to recommend that you allow us to use these funds as a cost offset to county services, our benefits administration, employee assistance program, wellness, and our work-life programs. Now, our current flexible benefits program is due to expire 12/22 this year and renew for 12/23. So we're asking that you allow us to do that. We have to hold an annual open enrollment. We would like to do that for the month of November this year. And upon approval, we will be able to run it for an entire 4 weeks, and we're only required to do it for 10 days. We like to give a lot of opportunity to make people have time to make informed choices. Now, the proposals that I've just explained to you were discussed, laid out for Labor Management Committee on our August 16th meeting, and they did not raise any objections to our recommendations. Mm-hmm. One final thing that we need to do is make a couple of minor modifications to our flexible benefits program document. In order to allow pre-tax contributions to a health savings account, we need to add language in there that allows us to offer that option, and we also need to add some language to restrict an employee from contributing to both a health savings account and a healthcare flex spending account at the same time, because they're restricted from doing so. So we have to make sure we put that in our plan document. We're also recommending that we renew our dental and vision plans. There are no rate changes, no increases for those plans, and that your board authorize our HR director to sign any renewal agreements that may arise after county council review. And we're here to answer any questions.
Supervisor Bennett? Mm-hmm.
Number one, I support the recommended actions, and I'll make that motion in a second, but I just wanted to find out, how could we get these rates every year like this? I mean, I'm joking. These are great. These are great rates. I mean, we're getting decreases, and we're also having very modest increases. Where we have a decrease in a benefit plan, we have some decreases. But these are really good rates in this time, and when you compare these to the national rates, that's really great.
We started strategizing in January, so we've been working on this for a while.
So I hope you'll start again. Go ahead.
Susan and her team have done an excellent job of working with our vendors to come up with the figures they got this year. We're over the moon, so to speak, about how well they've done this year.
Well, I want to say congratulations, and I know it was a lot of hard work to do that. But when you think about it, it is really the area if you live in the United States, it's the area that most people are most vulnerable at, and that is constantly rising medical costs, constantly rising insurance rates. And for us to do everything we can is a way for us to try to honor and support our employees who were not able to give pay increases of like the old days and stuff. So really appreciate the hard work, and I'd like to move the recommended actions.
We've got Supervisor Long.
I'd second the recommendation, and to thank you for a very good presentation and walking through the key components of it. And I appreciate that we have this standing labor management group that really tackles these issues and doing just what you said, Supervisor, and looking at how can we control these and keep both the package and the benefit good for our employees, but also affordable as you can in these days. So good job presenting it. Thank you.
Thank you.
Could I ask a question?
Supervisor.
Could you repeat the changes in the deductible?
For the PPO plan?
Correct.
Sure. The current deductible is $1,000 a person, and it is going to go up to $3,000 per person. And then the family deductible is $3,000, and it'll go up to $6,000.
But that's for the PPO.
Right.
And how
But
does,
they're getting a significant decrease in their premium, and they have the compatibility of the health savings account to help mitigate that.
okay, so it comes out to be about a wash.
Especially if they don't have a lot of expenses and they
That's
don't
right.
need to spend that deductible, they can come out okay. Absolutely.
Supervisor,
And the labor management team. And the labor management team supported the
Supported
idea.
that.
They wanted to do this, right?
Kelly?
the rate decrease will be about $8,100 a year for each employee, so that will more than make up the family deductible up to $6,000.
Mm-hmm. Well, thank you. Excellent presentation. We
Great
got a
piece of evidence to add. $8,100 savings.
There you go. Well, I was just going to say, you can tell Susan and Kelly and Tracy Sewell's here, their team really know what they're doing. It's a very complex area, a lot of hard work in advance to get this here, so thank you.
Thank you. So we got first Supervisor Bennett, second by Supervisor Long. All in favor? Any opposed?
And I do appreciate the fact that it went through the labor management team.
Absolutely.
We want to be able to get them